Good afternoon. Welcome with Dr. Mobi, Lifestyle with Dr. Mobi, and I'm Dr. Mobi. Today we welcome one of very dear friend and very well known in his field, Mark Word. He is a sleep and behavior consultant. Before we start the program, like to basically go over some things with sleep. So as we know, sleep is one third of our life. We're gonna spend in bed, and then a lot of people have problems with sleep, which includes either insomnia, inability to fall asleep or remain asleep, or both. And if it lasts more than 6 minutes, then we have usually a problem in
Yeah.
terms of, or it could be less than 6 months, which could be from any stress or situation. So whenever we have that, um, we always want to figure out what are the causes behind it and what can be done for it. So today we're gonna learn basically some of those aspects of sleep. So namely insomnia. So insomnia is one of the leading sleep problems we have everywhere in the world. Um, so especially also now with the current situation, it is more affecting people who are self-isolating or staying home. They are seeing a lot of these issues also. So with these words, we welcome Mark. We welcome you to our program. How are you?
Just fine. How are you doing, sir?
Good, good. Tell us about yourself, Mark. What do you do? And
Well, I've had a passion for sleep disorders because of my personal experience with family members who would just didn't get help, but they had so many problems in their personal lives and with their physical health. And I often found that I would bring these things up, sometimes directly to the doctor, if not the family members, but that wouldn't be addressed. And this included psychiatrists and primary care doctors. So right now I have a huge passion from seeing that if it's not treated, if there's nothing that is being worked on, people would have depression and irritability because of not sleeping well. And so I have a great passion because of how it affected my life. So right now I'm working in primary care as a behavioral health consultant. And what that means is meeting up with patients, and if they really do need to have something like go to a particular sleep.
okay, so I thank you, Mark. So you were saying about primary care role, and then basically in primary care you have some of these sleep issues, and you are screening them and working with them. So those are always very important to screen in primary care, because primary care is where you see most of these patients. So let's talk a little bit about insomnia. So some of the aspects you see is with their either they have some kind of mood disorders, they could have anxiety, depression. So what do you see mostly with anxiety, depression, or both?
Both of those things. A lot of times people are anxious, but they don't know that they're really depressed, or just vice versa. And sometimes what I'm doing right now is I'm looking at people who are being prescribed Ambien or Lunesta, and then I go to the primary care manager and say, "Do you want me to talk to this person about their sleep?" And so that's how I kind of do the back door. So sometimes they come to me that way. Sometimes it's through anxiety, and we really can't even get to the anxiety or depression if we're not dealing with their sleep disorder.
Mhm. And that is the other thing is I always tell people don't realize, but they are on a lot of medications like Ambien and Lunesta, and I tell them the sleep you're gonna get with these medication is not a natural sleep. Okay, so actually when we do
Exactly.
sleep studies, we can tell somebody is on these medication because they have these weird waves in their brain, and
Right, right,
which is going to affect your memory. It's going to affect how you feel next day. Your reflexes can be slow, not to mention you can have side effects. So natural sleep is very important. So first concept we'll want to tell audience is that hours of sleep are very important. Pay attention to that. Don't do things in the bedroom or by your bedtime which can cause problem for your sleep. So, namely, don't watch TV,
right.
and
Exactly.
don't be on your laptop computer because the light on the screen can really cause problem for sleep.
Right,
So there are a lot of studies about that. Other thing I always tell them is make sure that the environment is very important, which means that if we enter our bedroom, it should be conducive to sleep. So if we do in bed things which we are not supposed to do, then it blurs the line between wake and sleep. So then the problem is people brain say goodbye and sleep. So those are
exactly.
important concept. I tell them, it looks so. If you think if you're not gonna be sleeping for next 45 minutes or so in bed, get out of the bed, be
Right,
on the
exactly.
couch, read a book.
I came up with a nice little acronym to sleep like a baby.
Uh,
And the first B of baby is be in bed, be out of bed at the same time every day.
uh,
Anybody who has insomnia, some people can, of course, love to sleep in, but they don't have insomnia. But if you have insomnia, that is the cornerstone. Being out of bed at the same time starts your 24-hour clock, the circadian rhythm. And
mhm.
the A, a baby, is avoid napping. People, the last person I saw for this problem is she says, "Well, I don't really nap." She's watching television, falls asleep for half an hour. That is a nap. So
Yeah,
avoid
that
napping. So be out of bed at the same time. Avoid napping. That's
and that is so true that the napping, people don't realize that they're taking these multiple naps throughout the day, or and they say, oh, that, yeah, then they say we are napping. So it is very important that we have this understanding very clearly narrated to patients. Other thing I see is about the environment, to make sure the environment is very conducive. So I think that is so true, Mark, that naps, people don't realize
right.
that how many they can take during day,
And
and
then
then
and
it'll
then
be a
what?
problem for it.
I'm
Okay,
sorry. And
okay.
then
Oh,
what you just mentioned, what you mentioned is the environment. Is the other B is be in bed only to sleep. So that's a very important thing. People, your bedroom shouldn't be a multi-purpose room, especially with televisions of all things. And some people leave those on. So be in bed only to sleep. That's the other B. And then the Y is yawn or be sleepy before you get in bed. Many people I find keep getting in bed earlier and earlier and earlier. And that's going to ruin things because what you want to be able to do is actually the cornerstone was being in bed, being out of bed. So we do what is called sleep restriction. And I've heard about sleep restriction for a long time, but it's always helpful to have someone like me or someone to coach people to start with how many hours they're sleeping and then start adding those hours in front of the time that they're going to get up. Usually it's set by my children need to be out of bed. So let's say it's 7 o'clock and they're only sleeping 7 hours. Well, then we need to be able to take 3 hours and put those in front. And then we keep adding a little bit by little bit and avoiding naps and other things. And before long, they're sleeping better than they have in a long time. So
yeah.
it's a really fun thing to watch. But I also, as you do, and your expertise, Dr. Fasal, is that there might be some other things going on, like snoring and regular headaches, and they don't. And the other thing is gasping for breath that maybe they don't even know about.
Yeah.
But a sleep study is great as well because we
Yeah.
can do.
Yeah, and that is so true. If there's a problem with apneas, or whether there's a problem other than so insomnia can coexist with sleep apnea, especially if you're waking up a lot throughout the night. So the causes of arousals throughout the night are either from sleep apnea, or could be non-respiratory, which could be leg movement disorder or other issues. So those are very important aspects that it can coexist with sleep apnea, like you're saying. And for that, we need sleep study. So let's little bit talk about the effects on the behavior health, especially with anxiety, bipolar, or so. If they don't get plenty of hours of sleep, or how can it affect their prognosis?
Right, right. Well, it's interesting that you mentioned that because I just was talking to a man who's had his fourth manic episode where he went deeply into debt and caused all sorts of problems because he knows that he has bipolar disorder. That means that he has a manic episode,
Mhm.
and then after that, goes into a deep depression. And this time, at least, he was on medication. But
Mm,
what we discovered is that he had bad sleep discipline. So it wasn't his manic episode causing his not needing to sleep for a little while. He actually created it himself. And the research literature shows this, is that people have bad sleep discipline out of life. That means that they're doing something like having fun or have a new relationship or they're going out dancing or whatever they're doing,
mm.
but they don't have good sleep discipline. And that causes the manic episode to start. So that's the trigger. It's his life and bad sleep, and then he starts drinking energy drinks because he needs to do that at work, and then it ends up being a terrible.
Mm. And that is so important. People don't realize these energy drinks can um, also have devastating effect because it contains caffeine. Now, the caffeine is a little tricky. That usually, it can affect up to 3 to 4 hours uh, after you have taken. Even after that, it can continue to affect you. And after that, if there is a problem, so usually I say 3 times the half life of that. So it will be like 8, 9 hours. But everybody is very different. People can have sometimes have 1 cup of coffee and they will be up all day and night. So
Right.
pay attention to caffeine intake. I think that's a great point about these Red Bull and all other products. They take high energy drinks, because they can be really toxic to your sleep.
Absolutely.
So sleep is all about discipline and the regulation of your rhythm. Also, make sure you go out every day. So one of the important component of sleep is actually our circadian rhythm. So which means actually your body has a rhythm in the brain, melatonin and other hormones which regulate the clock, and this is synchronized usually by blue light. So if that blue light is not given to at appropriate time, then it can put this rhythm out for you, and then next thing will happen is body will not know whether it's a day or night, which means that during day you need to get out and look at the blue light, so, or blue sky, which is very important. So if you are on indoor basis, especially with the current situation, it can cause really a problem, because brain loses the track, especially whether you are indoor or outdoor. So brain is regulated by circadian rhythms, which means that it has these cells which keep working even we are indoors, and this clock is present actually in each cell and is regulated by master clock. And so it's very important. Once you throw the rhythm out for the body, it's very hard for body to realize uh, then what is right for you. It can affect a lot of your hormones, and those are very important too. So let's talk also about some of the therapies you mentioned. You do sleep restriction therapy, and then what else do you do for somebody with insomnia to keep sleep diaries and so forth?
Sleep diary.
So I think we were having a little glitch, but With sleep diaries, it is important that we keep track of the last 2 weeks or 4 weeks of the time they fall asleep or they wake up. So falling asleep and waking up, keep a log. The other thing is, so we want to make sure that their log is kept for all these 2 weeks. And then you were talking about sleep diaries, Mark.
Yes. Can you hear me? Yeah. Okay.
Yeah.
My picture was frozen for a second. Yeah, the sleep diary that I came up with, it makes it very simple, and anybody could do this. But one thing I've learned is not to use the Fitbit to help you with your sleep diary, but just what you recall, and you just at the end of the night, so you're not overly watching this. I used to wear a Fitbit, and I used to think it was really great, but I stopped wearing.
Yeah, that is so true about Fitbit. He was trying to tell. One of the components with insomnia is our hyperarousal, which means like our brain goes in state of hyper alertness. If you're wearing Fitbit and you're looking at the watch what time you go to sleep or what happened and how is the sleep, you're actually making it worse. So don't wear Fitbit or any products to monitor your sleep for that. I personally recommend people just other thing is very small, but it's very important. The clock. So the clock we have on by the bedside, if it has digits, then you will be looking at that and say, "Oh my God, it's been 15 minutes and I never went to sleep." So those are I was telling about the clock by the bedside. Fitbit we talk about. Also, other things you have noticed about that helps to keep the clock away a little bit and put alarm.
Right,
Um, and you were also mentioning before that waking up time. Try to maintain that, right?
right, yeah. So yeah, although it's nice to excuse me, although it's nice to have the Fitbit information, I find that basically I want to have good discipline and just stay in bed. Go to bed when I'm really tired and have a regular circadian rhythm. Uh, I imagine that if people are always taking melatonin or other things, their brain stops remembering how to sleep well. Uh, and I want to tell you, Dr. Moby, that the other thing is there was actually a directive: stop giving out Ambien long term or Lunesta because it's dangerous. And that now there's a so-called FDA black box. So
Mm.
there, in a sense, we're learning that it's long-term use of these drugs. It didn't ever make any sense, but now it's really detrimental.
Okay, and that is so true. So drugs are other drug which is commonly abused is or used, I would say both, is Benadryl. So Benadryl, you have to realize is gonna
Right.
last 24 hours in your system, and then it will
And very tired.
really it will make you dry, and next day your reflexes will be so slow. So just pay attention. Actually, sleeping with any medication is not really the greatest idea because it really changes your. Other problem I see is people sometimes drink and then they say, "Oh, we sleep better." Not really. It's gonna really make a lot of problem for a
Right.
lot of issues. It changes the architecture of sleep. People will have can develop sleep apnea as a result. Too abundant alcohol gets out of your system. It really caused a lot of arousals and a lot of problem for sleep architecture. So other things which we commonly see, yes, melatonin timing dose has to be important if you want to use it for short time. You can use it. Herbal teas are good. Chamomile is really good. So I was talking about chamomile, melatonin, and those are helpful. So give us your final thoughts, about Mark about sleep.
Yes, I guess, and thanks for having me on your show. it comes down to this: is if you think about it, the sleep is one of the elements of survival. And many people I've asked, because in the military I would ask people, what
So I think we were sorry having little difficulty, but it is very important that yeah, we want to make sure people pay attention to their schedule. People not taking too many medications, which they realize can cause problem next day. Keep it very simple. Other thing is very important is making sure do little walk or exercise. Walking actually improves the quality of sleep. So walk and exercise, make a routine. Don't do it very close to the bedtime, but walking is okay, or any relaxation exercise, but not running. So those are very important components that we're gonna focus for any patient or anyone who is interested in learning or fixing their sleep. So that is very definitely an important concept to bear in mind, and keep working on that. So Mark, you were sharing your final tips.
Yeah.
That's
And anyway, I was just saying that I would ask many soldiers when I was wearing a uniform myself, what is the biggest risk of going off to combat? And it's not that you'll come back without a limb. Most people come back with the limbs, but the majority of people, the one thing is that they don't sleep as well. And that is really what's behind a lot of PTSD, is never getting back to your regulated sleep, causing depression, anxiety, and making PTSD harder to overcome.
Mm. And thank you, Mark, for your time and sharing your thoughts on, especially realizing a lot of mood disorders actually can get worse with worsening of your sleep, and people
Or
can
even
become
cause them.
suicidal. Yeah, and so those are very, very important. My always advice is, yes, somebody has problem with sleep. They want to give them time to recover and get better. Brain take is a little bit slow to adjust to that, so they need have. So since that is a problem with sleep, is not like acute problem. It can be, but it usually takes time. So we should have a realistic expectation for patient that it usually takes time to improve, but keep working on it. Don't be discouraged. But it will get better because it's a learning process. Brain is a smart area, so it's gonna learn good and bad ways, unfortunately both, very quickly, and people don't realize. So once it does that, then we have issues with sleep, and it can affect our lifestyle, which also by the way includes eating habits and exercise. So if you're tired, of course, very hard to do any kind of exercise. So with the current situation, yes, it can really impact our sleep. So make sure keep it regulated. So regulation and learning for the brain, make it learn good things is very important. And we don't want to learn the bad habits, and we want to pay attention to all our habits. So with that in mind, thank you for your time, and keep us your feedback, Twitter, email. Thank you for watching our show. For all the audience, national as well as international. This is Dr. Mobi signing off. Thank you.